Hi, my name's Robert Sperling. I'm one of the interventional cardiologists here at MarinHealth. Today we're going to be talking about what happens when patients come to the hospital having chest discomfort. Patients typically come in one of two ways. Either they come to the hospital in their own private vehicle, what we call a walk-in patient, or they're brought to the hospital by an ambulance. The first thing that happens is a patient comes into the emergency department and they're quickly taken into one of the treatment rooms. And we ask what the symptoms are, what is a patient feeling, and if we have a high suspicion that they may be having a heart attack, the first thing we do is do a 12-lead EKG, and that gives us an electrical tracing of the heart and gives us clues as to whether a patient's clearly having a heart attack or not. At the same time, we're checking vital signs, we're drawing blood to look for any evidence of a heart attack, and also placing an IV so we can give a variety of medications to help treat a heart attack. Typically, the blood tests that we do include cardiac enzymes. So if there's damage to the heart muscle releases what are called cardiac enzymes into the bloodstream. If those are detected, that means that the patient has been suffering some damage to the heart muscle and can confirm that a heart attack is ongoing. If it's clear that a patient's having a heart attack, then the interventional cardiology team is called to come into the hospital if we're not already here and take the patient to the cardiac catheterization lab where we can directly look at the heart arteries and determine if there's a heart artery blockage. It's a blockage of a heart artery that tends to cause the majority of our heart attacks. If we do find a blockage, the quickest and safest and most effective way to stop a heart attack is to open up a blocked artery with a little balloon and then insert a metal coil called a stent. So here's an angiogram of a patient who was having a heart attack when they came to our hospital. This is the tube in the artery, and you'll see I inject X-ray dye into the artery. And the X-ray dye stops right about here where there's a complete blockage instead of seeing blood flowing all the way down to this part of the heart. So through that tube we put a small wire and inflate a small balloon. We add a small stent or metal coil, and then after we've done that you can see the picture of the blood flowing all the way down to this part of the heart muscle that was not getting enough blood flow. The stent was placed here, blood is flowing to the heart muscle, and we've stopped the heart attack. We've been able to achieve what we call door to balloon time or treatment time well under 50 minutes. The national average and benchmark is 60 minutes. So we feel very proud of that. Also which cannot be underscored enough is the working relationship that the hospital and cardiologists have with the community in raising funds and philanthropy to support our program. And the Haynes family has been a major contributor to this, and that allows us to have the cutting-edge technology that we need to be able to optimize our outcomes, best patient outcomes.